Hello, mic check. Okay. Hello, everyone. Hello, students. Today's topic of discussion is an important clinical case, that is galactosemia. The subject in the biochemistry, the topic is carbohydrate metabolism. Carbohydrate metabolism is in the NMC competency, that is 3.1 to 3.10. So this is important early clinical exposure question. It is clinical scenario based question where you can get a clinical case based question on this topic. Also you can get a short note SAQ, short answer question on this topic, that is either galactosemia or galactose metabolism. So it is important SAQ, short answer question, also important clinical case also. Number of viva questions are there from this topic galactosemia. So this is important case. And the important key feature in the galactosemia is the congenital cataract, oil droplet cataract, that is congenital cataract. Now see the case. An infant was brought to the hospital with complaints of vomiting, diarrhea, failure to thrive and jaundice. Failure to thrive means the weight gain is not proper, that is known as failure to thrive. And jaundice means, all of you know that jaundice means yellowish discoloration of skin and sclera. On examination he had cataract in both eyes and hepatomegaly. Cataract and hepatomegaly, these are the features. Plasma glucose was 45 milligram per deciliter, means hypoglycemia, 45 milligram per deciliter. Urinary reducing sugar was positive. Now see, plasma glucose is low and urinary reducing sugar was positive, means Benedict test is positive here. And what is question, what is your probable diagnosis? So think about the different clinical case. देखिए ये हो रहा है कि ये लग रहा है कि this is a case from carbohydrate metabolism, because there is comment on the plasma glucose level, also urinary reducing sugar was positive. Now see here, hepatomegaly, congenital cataract means cataract in both eyes. Infant means less than 1 year of age. So failure to thrive, vomiting, diarrhea and jaundice, these are the clinical symptoms. Now hypoglycemia. What are the causes of hypoglycemia? If you think about the hypoglycemia related with the biochemistry and the first MBBS student, what are the different diseases that comes in your mind when you are thinking about the hypoglycemia or low blood glucose level? So the most important is glycogen storage disorders. The most important. It is followed by the galactosemia, then hereditary fructose intolerance, and also medium chain acyl coenzyme A dehydrogenase deficiency, means coenzyme A means related with the beta oxidation, coenzyme A dehydrogenase, medium chain acyl coenzyme A dehydrogenase deficiency, that causes hypoglycemia. Means beta oxidation defect that causes the hypoglycemia. So these are the prominent diseases which causes hypoglycemia in the infant, principally the glycogen storage disorders. Now see here, urinary reducing sugar was positive, means Benedict test here, it is positive. Test for the reducing sugar was positive and blood glucose level was low. तो थोड़ा सा कॉन्ट्ररी है दोनों. मतलब जब 180 के ऊपर जब तक शुगर जाती नहीं, रीनल थ्रेशोल्ड जब तक क्रॉस नहीं करती, तब तक वो यूरिन में अपीयर नहीं होती. हियर देर इज हाइपोग्लाइसेमिया एंड डिस्पाइट ऑफ दैट देर इज यूरिनरी reducing sugar was positive, means Benedict test is positive here. So what is your probable diagnosis here? Now think about the cataract. What are the diseases which are important for the cataract in the biochemistry? For thinking about the first year MBBS, the cataract, it is important in the diabetes mellitus. See, cataract, it is important in the diabetes mellitus, that is snowflake cataract in the diabetes mellitus. Then there is cataract in the galactosemia, that is known as oil droplet cataract. In the galactosemia, it is known as oil droplet cataract. Then third one is the Wilson's disease, copper metabolism, Wilson's disease. There is golden brown discoloration of the ring that is known as KF ring around the cornea, and there is sunflower shaped cataract in the Wilson's disease. Okay. Now, vitamin A deficiency also causes the eye involvement. There is bitot spot, that is triangular white opaque spot on the conjunctiva, But thinking about the lens involvement, it occurs in the diabetes mellitus, snowflake cataract, galactosemia, that is oil droplet cataract, and Wilson's disease, that is sunflower cataract. Also, there is involvement of lens or dislocation of lens, that is known as subluxation of lens in the that homocystinuria and the Marfan syndrome. So these are also related with the lens, but not with the cataract. So here cataract is there, that indicates these disorders. So what is your probable diagnosis here, and what is the reason behind these symptoms? See the questions here. What is your probable diagnosis? First, mention the enzyme defect. What is a cause of congenital cataract, and what is reason for jaundice and hepatomegaly in this disease? So what is your probable diagnosis? This is a case of classical galactosemia. So it is a case of galactosemia, classical galactosemia. Which enzyme is deficient here? It is because of galactose 1 phosphate uridyl transferase. This enzyme is defective. And what is cause of cataract? It is because of accumulation of galactitol, also known as dulcitol accumulation in the lens, and osmotic effect of this dulcitol or galactitol, other name is galactitol, causes the opacity in the lens, that is known as congenital cataract. And why there is jaundice and why there is hepatomegaly? The reason for jaundice is there is accumulation of one particular compound, that is intermediate in the galactose metabolism due to deficiency of this galactose 1 phosphate uridyl transferase. So there is accumulation of galactose 1 phosphate in the liver. There is accumulation of galactose 1 phosphate in the liver, which causes jaundice, that causes the decreased uptake of bilirubin by the hepatocytes, also decreased conjugation of bilirubin by the hepatocytes. So there is jaundice, there is increase in the indirect bilirubin, and also accumulation of galactose 1 phosphate causes the hepatomegaly. There is also hypoglycemia. The reason for hypoglycemia is because this galactose 1 phosphate, it inhibits the glycogenolysis. That's why there is hypoglycemia. Now see the pathway or galactose metabolism in short. Now see, so here galactose, it is converted into galactose 1 phosphate. It is phosphorylated into galactose 1 phosphate, and this galactose 1 phosphate is converted into UDP galactose, and this UDP galactose, it is converted into UDP glucose. This is in short discussion of galactose metabolism. Now see the enzymes here. Here galactokinase causes the phosphorylation of galactose. It causes the phosphorylation of galactokinase into galactose 1 phosphate. Then galactose 1 phosphate uridyl transferase converts the galactose 1 phosphate into UDP galactose, and UDP galactose epimerase. This is third enzyme, epimerase. All these enzyme deficiency can cause the galactosemia, but these are the very mild form of the galactosemia by the deficiency of galactokinase and epimerase. The classical galactosemia, it is due to defect in the enzyme galactose 1 phosphate uridyl transferase, and there is accumulation of compound. The name of the compound is galactose 1 phosphate, which accumulates, which causes the symptoms. Also, it inhibits the galactokinase enzyme. There is accumulation of galactose, which is diverted. This galactose, it is diverted by the aldose reductase. This galactose, it is converted into galactitol. The other name is dulcitol, galactitol, also known as dulcitol. An osmotic effect of dulcitol causes opacity in the lens, opaque lens. So it causes the cataract, cataract in the lens. It causes cataract in the lens, accumulation of this compound. This is by the enzyme aldose reductase. Aldose reductase. So when infant is on the galactose diet, when it is on the breastfeed which contain lactose, which is galactose plus glucose. So here the galactose, the defect in the enzyme galactose 1-phosphate uridyl transferase causes accumulation of galactose 1-phosphate, which also inhibits the galactokinase. There is diversion of this galactose for the dulcitol production or galactitol production by the aldose reductase enzyme, and the osmotic effect of this dulcitol causes cataract in the lens, and this is classically known as oil droplet cataract. This is known as oil droplet cataract, and this is important MCQ for NEET PG entrance examination. Also can be MCQ in the first professional examination, and also a viva question, why there is congenital cataract in the galactosemia. Now what are the other features in galactosemia? There is hypoglycemia, glycemia. Then there is apart from the hypoglycemia, hepatosplenomegaly. Hepatosplenomegaly is there. Then mental retardation, mental retardation, and congenital cataract. These are the typical features. Omitting and congenital cataract. These are the typical features in the galactosemia, clinical features in the galactosemia. And the galactose excretion in urine. Galactose in urine. The Benedict test was positive. It is because of galactose in urine, reducing sugar in the urine, that gives the Benedict test positive. Also, it gives the mucic acid test positive when the urine sample is treated with the silver nitrate and it kept overnight. There is mucic acid crystal formation, that is known as mucic acid test, which is positive for the galactose in the patient with galactosemia. Now, why there is hypoglycemia? Because this galactose 1-phosphate which accumulates, it inhibits the glycogenolysis, it inhibits the glycogen phosphorylase enzyme. Hepatosplenomegaly, it is because of galactose 1-phosphate accumulation. Mental retardation, it is because of galactose 1-phosphate accumulation in the brain. Congenital cataract, because this is diverted for production of galactitol or dulcitol, which is due to osmotic effect, causes the cataract, that is known as oil droplet cataract. And galactose excretion in urine, as galactose level increases, it excreted in the urine and it gives the Benedict test positive. So this gives the reducing test for the reducing sugar, that is Benedict test positive. And why the blood glucose level is low? Because the GOD POD method, the routinely used method for the estimation, that specifically detect the beta D glucose. Here galactose, which is increases in the blood and urine, not the glucose. That's why the blood glucose level is low, 45 milligram per deciliter. That is hypoglycemia in this patient. So these are the symptoms. The laboratory diagnosis can be done by the mucic acid test for the galactose in urine, that is mucic acid test. Also the Benedict test is positive in the urine for the reducing sugar, it is positive. And what is treatment which is required for the galactosemia? The treatment here is restrict the galactose in the diet, means restrict the milk, restrict the lactose, restrict lactose and galactose in the diet. Shift the child on the commercial preparation. Shift the galactose or lactose free diet. So that is the treatment for the galactosemia. So there are multiple viva question: why there is cataract, why there is hepatomegaly, why there is mental retardation, why the blood glucose level is low, why Benedict test on the urine sample is positive, what is mucic acid test in the galactosemia. There is jaundice. Why there is jaundice? We skip that jaundice. So there is also jaundice. The reason for jaundice is this galactose 1 phosphate which accumulates, it inhibits the uptake of bilirubin by the hepatocyte, and conjugation of bilirubin is affected. Conjugation is affected because of this galactose 1 phosphate inhibit the uptake and conjugation of bilirubin. So there is jaundice, means yellowish discoloration of skin and sclera. So it first visible on the sclera because of the white of the eye and the elasticity of the tissue. That's why it appears first on the in the sclera. So there is jaundice. So in the treatment, you can give the phototherapy which converts this unconjugated bilirubin into the water soluble excretable form, that is lumirubin. So this is all about the galactosemia. So this is all about the galactosemia. So keep watching the ECE series. This is very important series, early clinical exposure for the diagnosis of various condition for the first professional examination. Also, this is an important short note. Galactosemia or galactose metabolism is the important short note for first MBBS student. So this is all for today. Thank you all of you.